Hey, what's going on, ladies and gents? It's Vince Gaddis, the health insurance guy, will help individuals, business owners, as well as families build the best benefits plan that you can find anywhere else, because this plan is built for you, built by you, and tailored around you and your needs. We are getting very, very, very close to open enrollment. Open enrollment is going to start in November. It's going to last all the way into December the 15th. So if you need health insurance or you need health coverage and you have a pre-existing condition, this is the perfect time to get covered right now, because after December the 15th, you won't be able to get any health coverage, and trying to get it through a private health insurer is virtually impossible. They don't have to take you at all. It is some private health insurance companies that would take you, but it would have exclusions. Or it may be expensive if you have pre-existing conditions. So if you have pre-existing conditions, again, this is the time for you to get a health insurance plan. November the 1st, open enrollment is right around the block. We're a few weeks away, so get it, because if you need it and you don't get it after the 15th, you're going to be in some ish. So again, today I'm going to talk to you about health insurance in general, but we're going to talk about the benefits of a private health insurance plan compared to a government marketplace plan. Now, if you don't know about me, I've been doing insurance for over 15 years. I've been on the technological side for a while, creating AI chatbots, helping with number one, cold calling individuals, and then number two, for appointment setting for insurance agents. I'm going to talk about the business of insurance as far as what is actually going on and why private health insurance, in my opinion, is better than an Obamacare. An Obamacare plan, a lot of times, and this isn't always, because it depends on your state. Every state varies. With Obamacare, the majority of those plans are HMO plans. HMO plans meaning that you can only go to a certain amount of doctors, or you can only go to this specific doctor, okay? You can't go to every doctor if you have an HMO plan. If you have a doctor that you've been going to for years and that doctor is not within that network, it's almost like not having health insurance at all. So it's very important to get a PPO plan if you do have an Obamacare plan, because they do have some Obamacare plans that do have PPOs, but very rare that your doctor may be in that network. And even if you do have a PPO plan, it's a marketplace plan, your doctor might not be in that network. It's a possibility. So it's good for, as an insurance agent or a broker, to check first before you sign up a patient or a customer for an insurance plan, just to make sure that that doctor is in that network, because it would suffer them to get an insurance plan and they're used to going to Dr. Smith and Dr. Smith isn't in the network, or Dr. Smith doesn't take that plan. So you want to cover your bases. Number two, is one of the good things about it is it's insurance. It's legitimate insurance. All right. I don't want to seem like I'm just ranting and talking bad about Obamacare, because it has its benefits. And just like everybody in the world, you guys know you get what you pay for. All right. A lot of Obamacare plans, they do have lower premiums, meaning that you pay a lot less out of pocket to maintain the insurance plan if you qualify for a subsidy. If you qualify for a subsidy based on your income, you may be able to get these plans all the way down to $0 a month. Like, you can't beat a free insurance plan for $0 a month, you know, but it is subject to your income. A lot of times when you get these Obamacare plans with $0 premiums, the deductible is usually ridiculous. This is what you need to pay first before the insurance company pays anything. The deductible in some cases is like $7,500. It might be $8,000 this year. It can change going close to open enrollment as far as the deductibles or the standard deductibles. But I know the last couple of years has been $7,500 to $8,000, almost $7,900 for a deductible. And again, the deductible is the amount that you need to pay first before the insurance company pays anything. Some insurance companies have co-insurance, which is after, or they may just have that $7,500 as your out-of-pocket maximum, meaning that's the most that you ever pay out of your pocket. I'll go into further detail with that on a later video. I got a lot of videos. Just check out my videos where I talk about a deductible, or I'll talk about an out-of-pocket maximum, because me explaining that to you will get you like ridiculously confused. Even I get confused, and I've been doing this a long time. So I want to make sure I don't confuse you on the other end when you're trying to get a health insurance plan, or even understand why you should go with a private health insurance plan compared to Obamacare plan. As far as for Obamacare, the deductible would be higher, but when you go and get procedures done, if you have an HMO plan and you do go to a doctor that's within your network, they will give you what they call a negotiated rate or a reduced rate. So if I came in compared to you have insurance, I don't have insurance. My bill might be $300, but because you have insurance and you are within that network, it might be $100 for the same procedure. So it does have its benefits, and everything that you do pay out of your pocket will go towards lowering your deductible. So for example, I paid $300 because of my injury or my checkup or whatever. You paid $100 at a negotiated rate. That $100 would go towards your overall deductible. So instead of a $7,900 deductible, you now have a $7,800 deductible, because that $100 that you paid was money out of pocket that reduced your overall deductible. Got it? Hope you got it. Good. So that's a little thing about Obamacare. Again, the deductibles can be high, your premiums can be low, but your deductibles can be high. And it might be good for you, especially if you don't go to the doctor that often, especially if you're in pretty good health, for more so accidents, serious complications, serious illnesses, or serious injuries. If you're young, you're active, you're in pretty good health, you don't go to the doctor that often, this might work perfect for you, because you're not going to the doctor often anyway. You want to save some money, go with an Obamacare plan. Now, with a private health insurance plan, this is going to allow you to go to a specialist. This is going to allow you to go to almost any doctor within the network, within that private health insurance plan. They're a lot more expensive, trust me. They're a lot more expensive because you're dealing directly with the insurance company. You're not dealing with any middleman. It's no type of subsidies that come along with that. This is something that you pay out of your pocket. With the PPO plan, these are really good for truck drivers and travel nurses. So if you're a travel nurse and you go from state to state, this would be a perfect plan for you, because if something were to happen to you and you're from Atlanta and you go to Missouri, it will cover you in Missouri. If you're a truck driver and you're on the road and you get sick, all food that you guys eat on the road, this sucks really bad, and you need to go to a doctor and get seen, you're able to go to a doctor and get seen, and you're not out of network. So it will have its benefits where you can go to any doctor immediately. Also, with the specialist side, it's so many times that I have seen people with HMO plans that have complications that they have to wait in order to go to a specialist, and those complications could be severity because they waited and it took too long in order to get themselves checked out. So get a PPO plan so you can go directly to that doctor and you don't have to wait when you have these issues, because then the clock is ticking. So these plans are going to allow you to go to the specialist or the doctor that you need to. And also, I can tell you this, with the private health insurance plan, a lot of the best doctors are within private health insurance plans. A lot of them are going to be in the HMO plans. They want to get paid. That's really what it is. The doctors, they want to get paid quick, and a private health insurance plan is going to allow them to get paid quick. That's why they opt into being within a private health insurance network, because they want to get paid quick. Obamacare could take a little bit of time. You guys know the government, they drag their feet on paying people. Same rules apply. This is the reason why there's not a lot of doctors within these HMO plans or Obamacare plans. That's the gist right there, because they want to get paid quick, and the government take a long time to pay anything. You guys already know my story, even with my mother. She had a stroke. She was literally paralyzed half of her body, and it took us 3 years fighting just to get $750 a month. So this is serious. I would urge anybody, if you are 2 arms, 2 legs, you can think well, you're working well, go with private health insurance plan. Go with something outside of having the government's hand on your life. Now, if you have pre-existing conditions, then you really don't have much of a choice as far as just going to get a marketplace plan, because a lot of the private health insurance plans, they aren't going to accept you because you have pre-existing conditions. They don't have to bring you in because you have pre-existing conditions. It will cost more money for them to insure you than the premium that you're paying them, because you have a higher chance of going to the doctor for sickness than you do for dying. So this is the reason why health insurance is a lot more expensive than life insurance. So I hope I kind of gave you guys a couple of scenarios on why private health insurance is a lot better than Obamacare. Again, it's more doctors that are within the network, the doctors they want to get paid soon. Obamacare plans, although if you qualify for a subsidy, it might be cheaper, but that deductible might be ridiculous. Even with the private health insurance plan, the deductible can be a little expensive as well. But again, you have options in order to go directly to a specialist. You have the option to pick the best doctors in that network. I mean, it plays a big difference. Trust me. Like, I can go on and on and on about the multiple stories about having private health insurance for myself and my family, because my wife had a thyroid. We had a Obamacare plan, and it was ridiculous, the type of doctors, not the doctors, but the type of people that were in the clinic, because they all had a government marketplace plan. It was a lot of sickly people, and I could tell that the doctor was probably overworked. He looked like he was overworked. The clinic was a little run down, and I didn't feel like this was the type of treatment that my wife or myself should go through. Even though we were saving a shitload of money on the insurance, the experience and the experience meant a lot, and I wanted to have the best doctors for her. We're talking about a surgery here, you know, and I want to make sure she comes off the table in one piece, but also to heal the way that she should heal. Like, she has a thyroid removed, but it don't even look like she had a thyroid removed. But I had the best doctors possible because purchased a private health insurance plan, and they were able to do what they needed to do for her. So I'm grateful that I was able to do that. But a lot of people don't know that you have this option. So if you are looking for health insurance, or looking for life insurance, again, Vince Geddes, a health insurance guy, you can reach out to me at www.getnextdayhealth.com. That's www.getnextdayhealth.com. I'm licensed all over the United States, but I am based in Atlanta, Georgia. I'm here to help you guys as far as navigate you through this thing called insurance. It gets very, very confusing. It does, but I'm going to break it down for you so that you can understand what you're getting. You can understand how it works for you. You can understand the claims process, which is most importantly, because a lot of people, when they talk about these insurance plans, they don't talk about the claims process. I deal with claims a lot. I deal with claims a lot for a reason, because I want to know exactly what happens when things go wrong, because my customers, they trust me to give them the right information. And I can tell you what the brochure says, and it's different from what the brochure says compared to what claims says. Trust me, it's a big difference, because claims, you gotta be honest, you know, it's insurance. So a lot of insurance companies, they want to save some money, you know, and not even just save some money, they will drag shit out if you let them, you know. And this is good to have somebody behind you that's going to fight for you, that's going to give you the right information, so that if things were to go sideways, you know exactly what to expect. You don't want to just have insurance and not know how to use it, not know what to expect. This is the reason why a lot of people think insurance is a scam, or insurance is not necessary, or this isn't a benefit for me, because they don't know how to use it properly. There's so many benefits of insurance, health insurance, accidental insurance, where you can cover yourself and your family. So again, you need this. This is what I do. Been doing this for a while. I want to help you. I want to help your family. I want to help your business. I want to help businesses be able to communicate this to their staff, to their teammates, you know, because open enrollment is coming, and people want to know what they're getting. They want to know how it works, and they want to know how it can benefit them. And if they don't know this, they're just checking check boxes. And you as a company, you look incompetent, because you should be educating your team, and you should be educating your employees on what they're getting and what they're paying for. This makes you look more sustainable. This makes you look solid. It makes you look like, hey, you know, I care about my employees, and care about your employees. You're talking about their lives here, and you want to make sure that their livelihood is very well taken care of, because they're able to work better for you. And you can reduce injuries, you can reduce sicknesses, you can reduce a lot of errors within your company by having someone come to your business and explaining how insurance works, and explaining the type of benefits that you guys have and how it can benefit them in their current situation, because everybody's situation is different. And when it comes to insurance, it's about tailoring the plan that's going to fit their needs and their budget. All right. So again, Vince Geddes, a health insurance guy. I'm here to help you guys. Reach out to me. Share this video with somebody who needs health insurance. Share this video with someone who wants to understand how health insurance works, because we are walking into the marketplace, health insurance, healthcare.gov era. I'll call that around November, where people can enroll into a health insurance plan. And I want to make sure that you're covered, and I want to make sure that your family is covered. Again, reach out to me to www.getnextdayhealth.com and book your consultation, and I'll be glad to help you and your family. Peace.